I've been doing human rights work for a long time, and I always marveled at the way a person who is in a situation that is so horrific and so painful and so horrible that it's literally trying to break his soul, and how many people have come through that and strengthened them. But my curiosity was how each person goes through that, and what is the thinking, or is there any thinking? Is it just like autopilot mode? So for a lot of years I rewrote, or I edited, polished the papers from Falun Gong practitioners who were in the labor camps, the Laogai, and who underwent just horrific tortures to try to break their faith and to break their souls. That's what the Communist Party wants to do to them. So it's not just on a physical level, it's much deeper than that, it's much sicker than that. And I was always amazed and curious, obviously how I would do in that situation. And anyway, so I look at that and then I say, what is it that gives us strength, and what is it that gives us physical strength? I don't think it's just physical. I think, yes, it manifests on the physical world, but basically it starts somewhere else. And I can say that because I did a lot of homeopathy when I was in medical school, and for 5 years after, and still do once in a while. And I saw things and changes in people that were amazing. Homeopathy would open the door for them to go to be who they wanted to be and who they were supposed to be, if you will. So the dynamics of the human body and the soul are all intertwined. And there definitely is a physical, mental, emotional, and spiritual side to every being. And every person has all of them developed in some way. Some parts of them are like 99%, and then other parts are 1%. Some people are all physical, or almost not all physical, but that's all they understand. They have the spiritual side, the soul side, but they don't acknowledge it or do anything or tap into it or understand it. Others are very, very spiritual, and they go pretty much through life just guided by intuition and by, let's say, a higher power or something that's higher than they are in the world or the universe. And so that leads me to want to talk a little bit about the terrain of somebody. And on Louis Pasteur's bed, the one that said it was the microbe, it was the bacteria that did all the work, that did all the damage, he actually said that no. On his deathbed, he said it was the terrain of the person. After working for years and years and years, seeing through research and seeing all the patients and the microbes and everything he was doing, he said, no, it's the terrain, it's not the bacteria. And I think we can see that from the perspective of COVID and the perspective of some studies that have been done in the past where people volunteered for this. I don't know if they could do it anymore, but they had a room full of people and they spread the flu virus, just the normal everyday person's flu virus, nothing that had any kind of mortality rate, around the room. And then they wouldn't tell anybody where it was, or so the people would be in the room and maybe, I think it was like 75-80% got sick, but there still was this 15 to 20% that never got sick, and they repeated it many times. So not everybody always gets sick from everything, and we can see that through the COVID. So why is that? That's my curiosity, and that brings me back to how the practitioners withstood the torture. I think it's connected. I think the torture issue is much more deep-seated, and you could say it's rooted in faith because they're defending their faith, but I think it's similar. And so, but I'll just talk about the more physical thing with the terrain, and your body has a terrain, and the terrain can be measured in many ways. It can be at the cellular level, it can be at the organ level, it could be the totality of the whole person, it could be at the kind of the microcosmic level, if you will. Maybe that's the spiritual level, is tiny microcosm, very small particles. Is that getting down towards more energetic until we can call it spiritual or not? I don't know. So let's just say it's very microscopic And homeopathy treats on the microscopic level. A drug would treat on the macroscopic level, the largest, hugest level there is, the cellular level, the organ systems. And then there's a whole hierarchy of medicines all in between. So bringing us back to the terrain, why is it that some people get sick and others don't? Well, there's a lot of work being done by an author named so-and-so. I have to look that up. And they talk about Mary Terhune, and she talks about how your thinking and how your fears and your phobias and all your whole makeup, but how you think, your psychology, how that impacts your health and how that can cause or eliminate the factor that you pick up something, that you become inoculated with the virus or heavy metal or something that's going to be detrimental to your body. It's going to hurt you. I know 2 cancer patients in my life who never went through any treatment. They went through the motions. They went to the doctors. They got labs, but they refused to do any treatments. And they're both still alive today. And this isn't everybody, but these 2 people were rock solid. They didn't believe in disease at all. They just didn't acknowledge at all. They weren't fearful at all, and they didn't acknowledge it. And they're going strong to this day. One's 75, one's 80. And it's been about 20 years since I've known them. So, take that for what it's worth. The majority of people go for treatment. And I'm a physician, so I treat people with medicine. But I also try to help patients get to maybe a little bit higher level with their thinking, and to give up those phobias, those fears. When I practice medicine, they come in to play for the physical body, because you can get so far with a patient. And if there's a deep-seated phobia or fear, addiction, and you can say, oh, that's all on the mental, emotional level. Well, it's going to affect the physical, and we can't get any farther with the physical till we work on that. So as you can see, every person is a whole parcel, is a whole package. And the only reason why I know this is I went through all this myself. Well, for a long time. I started my journey in 1991, and I'm still on it, and as we all are. So that's very interesting. So let's talk about the terrain and how I think the terrain is the most important thing. And naturopaths say this too. It's not just coming from religion or something like that. It's not. It's a physical level. Your terrain, you can measure your terrain. You can measure your secretory IgA in your gut and see where your immune system's at. You can measure your total white blood cell count. You can measure your lymphocytes. You can measure your neutrophils. You can measure your mast cells, your macrocytes. You can measure all these immune factors. But why do they act the way they act? That's the question. How far back do you have to go to find out what the root of the problem is? In homeopathy, they teach you to find that. It's an amazing system of medicine. Sometimes we have to look for the root of the root of the root. That's where we're going to find the cure or the big change for that person. And then their whole life will change if we can. Sometimes it's just talking about it and identifying it is good enough. But a lot of times these are very deep-seated phobias and things of that sort. So to even acknowledge it is a massive undertaking for a lot of people. But once they do, I would say 50% of it goes away because it just doesn't have the power to stay in their body anymore. And that's a whole other subject, but that's how I look at it. And once they identify it, then let's see, how do we get rid of it? And a lot of times it's in the subconscious, so there's no way you can think it away. That does not work. I had a lot of issues like this in the past, all kinds of fears, a lot of them deep-seated. And I practice the Qigong every day. That's what I do, and I study a book, and that was my path. But there's a lot of other ways to do it. And homeopathy, I keep saying homeopathy because that's a very powerful way, and it's actually where you take medicine. But that medicine works on a very deep level to open up your subconscious and start to eliminate some of these phobias and fears and anxieties and addictions. But you need to walk through the path. You need to walk through the door. It will create a door for you that you can never see, but you need to walk through it. And you have to be strong, and you can't have fear. I mean, obviously, most people have fear, but that will go away little by little. And look, you fall down. Look how many millions of times did I fall down until I got to a point where I didn't have almost no anxiety and no fear. So, and I was riddled with it. So definitely, if I can do it, anybody can do it. I think we'll stop there for today.